As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission, I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain, keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, let's camera action, I'm ready to go.
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio.
Hey, good morning all. My name is Earl Bloodworth. I want to thank Tom Ficklin for the opportunity to guest host in his absence. I'm sure he's doing some great work or whatever he's endeavoring at this moment. I want to thank Harry Draws. We're going to have several guests join me throughout this time and in this short hour. We're going to start off with Rob Ebert, who is, I want to correct me if I'm wrong in this, Rob. I know you wear many hats and many titles. In this capacity, though, you are Rob Ebert, VP of Development for Career Resources and Reentry.
Super close.
Super close.
Senior Vice President for Business Development and Reentry Affairs for the agency. And I co-chair the Bridgeport Reentry Collaborative.
Awesome. Thank you. Okay, so, with that being said, Rob, could you describe a couple of the things that you work on with that elongated title?
Sure. So on the agency side of things, when new opportunities come along for the reentry side of the house, I sort of engage and work with our development team to make sure we put our best foot forward. I'm also always working on collaborations with other entities, whether it be the City of Bridgeport via the Bridgeport Families First program, or Community Partners in Action, or any of the workforce development boards who do have a responsibility to serve the reentry community. On the reentry side, the straight reentry side of things, I oversee our programming. So we have a fatherhood program, which is kind of tilted towards folks that are justice involved. Obviously, I supervise our staff that work on the Bridgeport Families First program with the city. We have 4 facilities where we house residential work release participants for Department of Corrections, one of which is the Lucy Bainey Family Reunification Center. Mm-hmm. I would like to say best in class facility serving women, both in the work release side and women and their children when we have a woman who might need to be housed with their child.
That's first in the state though, too, correct? With the residential program housing children and the mom?
First in the state to have an on-site child care. So there was a program that existed before that when it came up, we applied for it and we won it from the incumbent. But we added an on-site child care in partnership with the Alliance for Community Empowerment and Dr. Monette Ferguson's group.
Big up to Dr. Monette Ferguson and her group, they're awesome.
They are absolutely the best. So, and then on the co-chair of the Bridgeport Reentry Collaborative side, I chair monthly meetings with community-based providers, returning citizens, elected officials, law enforcement, parole, probation. And that group has been meeting every third Thursday of the month since May of 2007.
Wow.
That's the longest continuously operating reentry council in the state. And I am honored and fortunate enough to be one of the co-chairs of that group.
Awesome. That is a lot of stuff, man. I don't know where you find the time. I hope you get some time to relax, man. I'm joking. There's no relaxing in reentry. You all know that. So one of the things I really wanted to discuss for a moment, we don't, with these kind of segments, I wish we had a whole hour long just to focus on this one topic, but I really want to touch a lot on reentry and stuff that's going on in this world that a lot of people may not know about. So recently there was just published with the press release up at the state capitol, some work that you and Career Resources worked on that was spearheaded by Scott Wilderman, the president. and CEO of Career Resources, around a point in time, so to speak, count for reentry. So if you can give us some insight to what is kind of the meat of that, and kind of what areas it covers, I'd greatly appreciate it. And again,
Sure.
remember, you're talking to some people that have no idea what you're talking about.
I understand. So the genesis of the report was that providers and curious people who wanted to know what folks looked like, what the demographics were about people that were being released from incarceration. On the provider side, it was, the practical piece was that, when we're applying for grants and contracts and we want to use proper language when we're talking about statement of need, we didn't really have a body, a document that we could look to that was sort of easy to understand. Office of Policy Management does some stuff around that. They do a monthly report, but it's kind of complicated to read through some of it. So we engaged the Department of Correction and the Court Support Services Division of the Judicial Branch, and we pulled down a ton of data. And it took us about a year. We engaged Dr. David Garvey from UConn's Public Policy Department to crunch all that data for us. Then we further engaged Dr. Sarah Diamond and Diamond Consulting to take that data and put it into a format, again, which was easy to read, easy to understand, and easy to use. The report itself was broken down into sections based on the reentry council that a person would be going to regionally. There's 10 of those, by the way, Bridgeport being the first, and I don't want to get into all those, but there's 10 different ones. And if you are a provider in, say, New Britain, you flip to the New Britain section and you know what your people look like with regards to race, gender, age, risk factor, education level, whether you're married,
children,
whether you're married or not, whether you have dependents. And again, it allows, the report itself allows for us as providers and practitioners to provide appropriate interventions to help these folks not reoffend and go back to prison. The idea of the report is to help us do our jobs better and to inform the public about who these people are and what they need.
Thank you. It's nothing like an informed service provider to be able to provide accurate needs. I'm just saying it's very real, So with that being said, I know this is the first time this has ever been done, so kudos to you guys and everybody that was involved in putting that together. It's going to be looked at. People are going to have their opinions about it. They're going to, people are going to ask for additions. Even myself, I looked at it, I was like, wondering some information about housing. And I know all that stuff is going to be improved. When this is the first time, it was a Herculean task. And getting all these stakeholders together to get this data and then crunch it. So can you tell me something that really sticks out to you? Because I know a lot, especially in the big urban areas, Bridgeport, Hartford, New Haven, the consensus, or the anecdotal consensus, is that we see roughly 1,000 people released back into our communities a year. Did these numbers bear that out, or was it close? Or as the study expands, will we see more? Because I don't know, like, if pretrial population was counting in these numbers or not.
Yeah, they were. The problem, I guess I can call it a problem, with the timing of the study was that it was done during COVID.
Right. Okay.
There was a lot of what we call compassionate release that occurred. People wouldn't normally be getting out, but they did because of pre-existing health factors and health risk. Less people were going in because trials and cases and dockets were being delayed. So you ended up with this shrunk down prison population and expedited releases, which probably are going to be I hope not an anomaly, but if we're going to be real about it, probably is somewhat of an anomaly. And it really stressed the system. On a side note, I think you're going to have Elena here shortly, but it exposed a lot of holes and weaknesses in our social service system. most notably around housing. You know, there were some fortunate things that occurred there. I mean, hotels weren't operating, so they became spaces for people on a temporary basis. But yeah, to your point, to your question, the numbers bear it out, but I would caution you when you read it to assume for maybe 20% higher releases ish than you would normally see based on the COVID issue.
Okay, cool. And where can people find, I know you guys have hard copies. Where can people find this information? Or where will it be located?
It is going to be on our website, and as soon as our marketing people get to it, that's www.careerresources.org. We have made the request of the Connecticut Reentry Collaborative to put it up on www.ctreentry.org. And all of our partners who have been given digital copies may be putting it up on their websites as well. I assume the city at some point, City of Bridgeport may put it up, City of Hartford may put it up. But it'll be out there easily to be found shortly. And oh, by the way, in like 2 months, we have to start the next one.
Indeed. So with that being said, I know your time is short with us. Two things. There was a panel discussion after the press release. Is that available? Is that going to be available for people to view on the website as well?
It is. I have the rough version of it currently. Senator Tony Wong, who was one of the sponsors of the panel discussion, his staff is cleaning it up and making a sort of for a polished version of it. And as soon as I get that, I'll be pushing it out through my networks. And again, we'll probably put it on our YouTube page. Probably put a link to it on our website as well as the ConnecticutReentry.org website.
Awesome. And then other big news, no short of big news is coming out of Bridgeport right now. We have the Pilot Welcome Center coming. You want to just give us a brief snippet on that or we let you go?
Yeah, sure. So just background, again, just for listeners, the community, one of our partner agencies, Community Partners in Action, they partnered with the Hartford Foundation for Public Giving in the city of Hartford 3 years ago to launch the first reentry welcome center in Hartford. And they've been grossly successful. They've done a really good job. And it really highlights how collaboration wins. You know, doing things on your own isn't always the best idea. So they brought all the partners together, and they've done a wonderful job serving what we refer to as end of sentence clients. And then that means they don't get released to probation or parole or any form of supervision, and they're kind of just on their own to figure it out. Well, not anymore, because cities like Hartford, then New Haven, then Waterbury, and now on April 25th in Bridgeport, these people will have somewhere to go. And the model is that we have a memorandum of understanding with the Department of Correction, and anybody who's an end of sentence person will be driven to the Welcome Center in Bridgeport. They will be walked inside by a Department of Corrections employee and quite literally thoughtfully handed off to our staff at the Welcome Center. And the Welcome Center itself is a partnership with funding through the American Rescue Plan in the city of Bridgeport. There's a partnership between the Recovery Network of Programs, who do mental health and substance abuse treatment, and Career Resources, who is us, who do a lot of employment and workforce development and reentry programming. What we can't handle between our two agencies, we will be referring out to our partners who've signed on to be partners in the center, such as Homes for the Brave, who handle Veterans Affairs, City of Bridgeport Myra program, thank you, Mr. Bloodworth, who are going to be doing a lot of work around ID procurement. Yale Transitions Clinic, who's going to be handling straight healthcare. PCAR, which is going to do substance abuse groups for people. And there's a whole host of others, but the idea is to set a safety net, put a safety net in place where any acute service need that a person has, they'll get quickly.
Well, thank you very much for that. And that's a great transition because you talked about some of the partners. And as we kind of get through some of our guests, and I appreciate you all waiting patiently and I know you have a lot to contribute, and some of you have less time than others. I wanted to, again, thank you, Rob Ebert, with your very long, extended title. And one of the partners—
Trying to shorten it, trust me.
One of the partners that you guys will be working, I'm sure, of is Kaz. And from Kaz, we have Mr. Dwight Davis. Mr. Davis, if you could please introduce yourself and kind of some of the work you'll be doing with Kaz and CRC in your new programming.
Yes, sir. Thank you. Thank you, Earl, for holding this forum. And Rob, thank you for all the work that you've done, that you're doing, and that you're still about to do. And I appreciate that informative press conference and panel Tuesday on the state of reentry. Really, really great information. And I appreciate that. Appreciate you.
Thank you for the kind words.
You're welcome. And yeah, my name is Dwight Davis, and I'm from CAS, the Connecticut Association for Human Services, and I am the CRC Reentry Program Coordinator. And what we do there is we engage individuals that are returned back into society, individuals that are a year to 6 months out from returning back into society, from being released, or those that are justice-involved individuals with literacy, with financial literacy. And what we did, we're attempting to provide them with the tools, the knowledge, and the resources to alleviate some of the financial barriers that they face when returning back from society, returning back into society. Hopefully, thus lowering the recidivism rate, because as we know, a lot of our returning citizens struggle with money issues, financial issues, budgeting issues, and so forth. This prompted us at CAS to seek a partnership with the Department of Corrections, reentry programs, and other partnerships with the goal of extending our financial services to those who are incarcerated and are participating in our reentry programs. And as this program continues to go, we'll continue to cultivate new partnerships with the hope of reaching as many at-risk citizens as possible. And through our through our asset building programs portfolio, we have an array of financial literacy workshops and programs that we'll be able to offer our returning citizens. One of our programs is our Connecticut Money School, which provides trained financial coaches within the state who are ready to help clients meet financial needs free of charge within Hartford, New Haven, Litchfield, Fairfield counties. We also have, yes.
Dwight, sorry, I don't want to interrupt, but I am interrupting. Okay. I apologize for that.
That's okay.
Just a couple of things. Can you just tell us, one, what CRC means? And I was just about to ask, geographically where you guys are working at. You started to mention that. And I want to dig into that just a little bit more. But what exactly does CRC stand for?
It's short for CAS Returning Citizens.
Ah, okay, cool. Yeah. I wasn't aware of that. I knew CRC, and I've come to several of those meetings, and I'm working with you guys, which, again, you're just talking about the geographical areas that you're going to be working in. I know we have a memorandum of understanding with CAS to work with this program, provide, some financial literacy to folks that were justice impacted or newly released coming out of prison. And so I'm definitely looking forward to putting all that together. But can you just kind of talk about some of the impacts that lack of financial literacy has on this population? The being unbanked, not necessarily being able to have credit or access to credit, how that might impact their social economic mobility to, start a business.
Exactly. Yeah, you're absolutely right. The unbanked is such a big portion of today. And what we're trying to do with our Bank On CT program is we're trying to connect our citizens, our returning citizens, back into the mainstream of banking. We understand that a lot of our returning citizens have had negative relationships with banks as a result of overdraft fees or bank fees of which they can't pay, which causes the domino effect of if one thing bounces, a whole bunch of things bounces, and then they end up just abandoning the account. So we've had a lot of citizens that, giving us feedback that they have negative relationships. So what we're trying to do is we're trying to reestablish them through our bank on accounts, where these bank on accounts provide safe, affordable accounts, bank accounts, with no fees and no overdraft fees. And we also understand that, some people, and some of the requirements to our bank on, some people may have to go through the check systems, and they may be in check systems. So they may not be eligible for some of those accounts. And if that's the case, we also have what we call a DORA account. And it's an online banking app where you can apply, when you can go in, sign up for the account. If you're working, you can sign up for direct deposit. You'll be able to get your paycheck 2 days earlier. You'll actually, as soon as you sign up, you'll be assigned your debit card, and you'll be able to do banking transactions online just like you would a mainstream bank. A lot of our returning citizens are not well versed in budgeting issues, debt reduction, the ABCs of credit, understanding how credit affects every area of their lives, from housing to employment to their ability to get financial products, at a reasonable rate. So what we're trying to do is educate people about this process through our financial literacy programs that we have, and with the hopes that they can. We also provide free through our VITA program, our voluntary income tax assistance program. We provide them with free tax preparation for any individual with a paid job, whether in prison or out here in society. And all of our VITA counselors, all of our VITA volunteers are trained IRS certified volunteers. So they're well versed in all your credits that you're eligible for, earned income tax, Connecticut child care tax credit, and whatnot.
Where can folks find the information in their local area, say for Bridgeport, New Haven, Hartford, Waterbury?
For Bridgeport, we're one of our VITA sites is at the Borough Center. But if you're in New Haven, I'm not exactly sure, but you can always go on to 211.org. 211.org, and then you can access where the nearest VITA site is to you. And it's a free service. It's a free service for anyone that makes up to $58,000 a year. And all you do is bring your tax papers that you need, your ID, your bank account, and whatnot. And once they prepare it, they'll submit it.
That's awesome. That's awesome. Looking forward to hearing some more success stories from you guys at COS and CRC around the individuals that you help to get back into the banking world with Bank On and other services that you offer. I want to thank you for your time, sir.
You're welcome. Thank you.
No, thank you, man. You're doing great work. I'm looking forward to working with you, as I am happy to work with all the folks up here. And again, it's unfortunate. I wish we could have just a show with everyone individually on their own, because there's so much to talk about in reentry. But this brief show that I'm guest hosting, thanks to Tom Ficklin, we're talking about some of the state of reentry. With that being said, I wanted to get to my man Gus here, Gus Marks Hamilton from Smart Justice and ACLU. I know you're in the midst of doing multiple things, and more than likely you're probably up at the state capitol if I had to guess.
No, well, I'm in Hartford right now, but I'm actually in our office.
Okay.
There's a judiciary hearing going on right now. It's virtual, so I'm trying to keep an eye on that because we have a bunch of people testifying with the Smart Justice campaign right now, but I'm not at the Capitol. I'm actually in our office.
Here's the technology and virtual.
Yes, sir.
So what are some of the things that, well, first of all, if you want to, you got a moment, you tell us a little bit about yourself if you'd like to, or you want to just get into what ACLU and Smart Justice is all about and some of the bills that you're focused on in this short session.
Yeah, thanks so much, Earl, for having us on. My name's Gus. I'm the campaign manager with the Smart Justice campaign at the ACLU of Connecticut. And I guess sort of the core thing that we do at Smart Justice is we try to center the work that we're doing, which is primarily legislative advocacy at the Capitol, But we try to center everything that we do in the voices and experiences of people who have spent time inside, who have been locked up. I'm somebody, I was locked up here in Connecticut for nearly 8 years. I've been home for a few years now. And all the lobbying that we do, the direction of the campaign, everything that you see that we do on social media, that is all about the voices and the lived experiences of people who have been directly impacted by the criminal legal system. So we officially launched back in 2018. So we're in I think our fourth year now. Yeah.
1 second, Gus. I just want to go back to what you just said, because I don't know if people really notice what you just said. You said criminal legal system. You did not say criminal justice system.
Yeah.
I peeped that.
Well, it's like a tongue twister, right? Because everybody's used to saying, criminal justice, but a few years ago we tried to switch that up because none of our folks have ever actually experienced justice in the criminal justice system. So yeah, we've tried to change that around. Same way that we try to use people first language when we're talking about people who've been directly impacted. We try not to use words like criminal, felon, inmate, prisoner, all those types of demeaning, dehumanizing, stigmatizing language. Because like when I introduce myself, I say I'm somebody that is a licensed master social worker here in Connecticut. I'm a taxpayer. I'm a brother. I'm a son. I'm a doting uncle to my nieces, and I'm somebody that's had experience inside our state's prisons and jails. But that doesn't define who I am, and it certainly doesn't define what I'm capable of doing in my life.
Thank you. So what are some of so you mentioned that you're keeping an eye on the hearings that are going today.
Right.
What are some of the things that you're focused on, that the ACLU Smart Justice is focused on? I know you guys, along with a huge collaborative, we had some big wins last legislative session with clean slate legislation and some other stuff. Some stuff got passed the way we wanted. Some stuff got passed, but needs to be amended to a certain degree. And then some stuff didn't get passed. What are we focusing on right now in this short session?
Yeah, that's the way it goes with the legislative session. It can be really fulfilling in some ways, and also you feel like you got to compromise on certain things and try to come back again the next year and keep working on it. A lot of these bills take multi-year, many years before they're finally passed. Some bills, like one of the bills that's up in the Judiciary Committee, was actually passed last year, but vetoed by the governor. So the folks that are pushing that bill, which we're supporting, are back again this year, hopefully trying to get it signed into law this year. Some of the priority issues that Smart Justice is working on this year is looking at occupational licensures for people that are living with a record and are trying to find ways to support themselves and be able to support their families. That's House Bill 5248. If folks are interested in learning more about that, that was just passed yesterday by the Labor Committee, out of the Labor Committee, that is. So it's now headed to the House, and we'll hopefully have some traction and get passed this year.
That came out of the collateral consequences study, correct?
Yep. Yeah, absolutely.
Okay.
All this stuff is like stuff that gets built on each other. So the Council on the Collateral Consequences of a Criminal Record was formed back in 2019. They did a lot of work studying the collateral consequences, many of which have to do with people's ability to find housing and be able to find employment when they're living with a record. That group released a report in the beginning of 2020, right before COVID arrived. And then a lot of the work that group did is now coming out in legislative work. A right to housing for justice impacted people, opportunities to find employment if you're somebody that's living with a record, occupational licensure, like House Bill 5248 is all about. For me, as somebody who's a social worker, for people that have lived experience, and you're trying to get into the social work field, that is like gold. But very often you see people that have felony convictions, people that have backgrounds, have a difficulty becoming licensed clinical social workers here in Connecticut. And an opportunity to be able to do that type of work, but not be licensed is a challenge. It's a problem. And House Bill 5248 starts to address that.
That's awesome. Great. And like you said, a lot of this work is built on previous work that had been done. I know, so with the clean slate, as it started to get passed in other states, it kind of got revived here, but that the language and discussion of clean slate legislation started, I know, with some folks back in like 2007 here in the state of Connecticut, like with Lorenzo Jones and some of those folks doing work.
Absolutely, yeah.
With the Better Way Foundation. So it unfortunately, it does take time. We are to land of steady habits, but I definitely appreciate you guys at ACLU your collaboration and the partnership and the work that you do throughout the entire state, along with all our guests. Dwight, as well as Rob, it's a collaborative effort. We're not doing anything in silos because it'll never work.
Yeah, we heard that in the. That's exactly what we heard in the press conference the other day. The Career Resources set up on the state of reentry is that we can't be working in silos. All this stuff intersects with each other. We can't talk about housing. We can't talk about employment. We can't talk about the economic health of the state overall if we're not talking about people who are living with records and need to be able to provide for their families, be able to support themselves, be able to raise their families and their children. All this stuff is tied together. So one of our values at Smart Justice is that everyone has a role in ending mass incarceration, because we truly believe every person in the state, whether you've been incarcerated or you have a family member or a friend who's been incarcerated, or you simply care about the direction of your tax dollars. You care about the impact that the criminal legal system has on your wallet. Everybody in some way in Connecticut has an opportunity to take a role in creating a better criminal legal system here.
No, I totally agree. And I expressly agree about the intersectionality. Rob mentioned about the program called Bridgeport's Family First. And it's a program that I'm heavily involved in, City of Bridgeport and the Mayor's Initiative for Reentry Affairs. And what we're looking at is working with parents that are incarcerated while simultaneously working with their families, caregivers, or significant others in the community, because we focus on the individual that's justice impacted. And like you just said, it's not just the individual, it's the whole community, it's their family, it's everyone. Yeah. If we're not looking at treating the whole system, organism of it, then we're doing a disservice to the community and to everybody that's involved. So,
yeah, 100%, absolutely.
So yeah, like you said, housing discrimination, all of it's connected. Housing is a key stabilizing factor for individuals coming out of prison. We expect folks to get their life together, but how can they do that? They have these collateral consequences. They can't get gainful employment, livable wages. There is issues to, accessing IDs, which we're trying to, work with DMV and DOC to make that a non-issue, because that's a critical component to success, having a state ID, getting connected to housing, employment, continuity of care, financial literacy. So, yeah.
Yeah, Earl, if I could just tie that, what you're talking about, to one of the bills that's being heard today in the Judiciary Committee. It's a bill looking at prison debt laws. A lot of people don't realize that if you're somebody who has been incarcerated, the state, Connecticut, has the ability to sue you for the cost of your incarceration. And that's one of the bills. I think it's, I just got to figure out my numbers here. That's House Bill 5390. If people are interested in learning more about that bill. I just saw Fred Hodges just testify.
I was just about to mention, Brother Fred Hodges and Brother Daim McKnight have been preaching about that for a very long time.
Yeah, again, that's a bill that's a law that's been around for a couple of decades right now, and so many people in the state of Connecticut have been impacted by that bill, where they're in a car accident and they receive some sort of monetary settlement. The state has the ability to sue that person for up to half of whatever their settlement was, and take that money from them, and that's money they probably needed to help their families to be able to get their life going again. But the state of Connecticut right now.
That's up to 25 years after they've been released, I believe, correct?
Yeah, that's right, Earl. So that's one of the bills that's in the judiciary hearing right now. A little bit earlier, we heard the commissioner of the DOC testifying on the PROTECT Act. That was the bill that was passed last year, having to do with solitary confinement, modifying the way solitary is used in Connecticut. It was a bill that was vetoed by the governor, so they're back again this year, working on that. We just heard the commissioner speaking about that. And then one more bill that I wanted to highlight for you guys is Senate Bill 460. That is compassionate parole release for people that have medical issues, who are still incarcerated, but pose absolutely no risk to the community, and are probably better off, like when we had COVID for a couple of years. Their safety, they're more safe. They'll probably be more healthy if they're not in a correctional institution, where we've seen what's happened with the spread of COVID over the last 2 years inside the DOC. So people that have medical issues, medical complications, who are elderly, are better off in a community setting as opposed to being incarcerated.
Awesome. Thank you again for your time, Gus. I really appreciate it.
Absolutely.
That's a lot of information. I'm glad this interview session is recorded so people can refer back to it. There's a lot of bills that you talked about. And they can go, was that CT, what's the website to go check on bills or if you want to follow bills?
Well, I mean, first of all, you guys can follow us. We're acluct.org. You can join one of our action teams. You can get alerts about the stuff that we're working on. And then, of course, people can go to the Connecticut General Assembly's website, too. There's bill searches on there. I just highlight some of the bills we're working on. HB 5248, that's the occupational licensure bill that just came out of the Labor Committee yesterday. And then today in Judiciary, it's HB 5390, that's the prison debt law. Senate Bill 459 is the PROTECT Act. And then Senate Bill 460 is compassionate medical parole for folks who are incarcerated. So I know it's a lot of information. I apologize for rattling off right now, but I appreciate the opportunity to come on the show, though, Earl.
No, definitely appreciate you taking the time. I appreciate all the guests here. With that being said, talking about the intersectionality, I do have, you guys are great, but I do have a premier guest here, which is Alana Rosenberg. I wanted to get in, as we've been talking about the state of reentry. I know, Alana, you and your outfit have been doing some great work and looking at some study information regarding housing stability and recidivism and the impact of public safety. So I want to know if you could share with us some of your time with that. And if you need to share anything, I can give you guest host capabilities, or if you want to just discuss it and not show any type of PowerPoint, you're more than welcome. However you want to run it.
Thanks so much, Earl. Before moving on to the sort of study that I'll talk about, I do want to just say that I just submitted my testimony in favor of the PROTECT Act just now, and I think part of what Gus is talking about and all this kind of really amazing action that makes all these bills come up is us as citizens, like learning the process of how to be a good citizen and take responsibility for what's going on. And so in the last few years, I've learned a little bit about writing to my representatives and showing up at the Capitol and sending testimony and even doing verbal testimony. So for people that are impacted and just the general public, this is such an important skill that we have the responsibility to kind of be more versed in. And so, Gus, thanks so much for making it so available to us. And I encourage everybody just to learn and, take one thing that you feel really passionately about and Stop Solitary, the organization, is amazing in supporting people who want to see an end to solitary confinement in the state. Amazing advocates doing that work. And, in all these issues.
Big up to Ms. Barbara Fair. She's been doing it for a very long time.
And there's just such a community now that I think is new. I don't think it was there 10 years ago. And that it makes me feel like we're getting somewhere. So thank you for your work on that. And so I'm actually here to talk about a study. I manage a project called the Justice, Housing, and Health Study at Yale University. And we followed people who enrolled in our study in 2017. The purpose of the study was to study how mass incarceration and housing are interconnected and affect health. And we did that through enrolling 400 folks in New Haven. 3 of them had a criminal record. 200 were recently released. And we followed them for about 2.5 years to see what was happening to them in terms of their housing and health situations. And we learned a lot of things. We wrote some papers. And this, recently Earl came to me and said, well, what about housing? What's the connection with recidivism? And I said, we hadn't looked at the data that way, but that's a great question. And actually, we did track when people went back to prison. So let's look at where people were living and how it impacted whether they were able to stay out of prison or not. And so we ran this study. It was focused specifically on the 200 people that were released. This is in New Haven. And we said, okay, if they come into our study and they're living at this place at this time, what happens within the next 6 months? Where do they go and are they returned to prison? And it turns out that we expected to see that homelessness caused people to go back to prison. That was sort of like what our hypothesis was, right? That if you were homeless and didn't have a place to live, there's so many pathways that get you sent back to prison, including, surveillance on the street, increased kind of chaos in your life that causes things, substance use and other things. But we also wanted to look at what other housing situations where people were in, and where, what that meant in terms of their likelihood of staying out of prison. And what we found was not only was homelessness associated with recidivism, but virtually every other housing situation except having your own spot. So either, if you we compared people who rented their own place, or were in some kind of permanent supportive housing situation. We compared those folks to people who were living with family. So people who were, let's go through I'll do it in order. So people who were living in sober houses were 3 times more likely than someone with their own place to go back to prison within those 6 months. People who were either living in a halfway house, some kind of temporary program, or with family, those people were 9 times more likely to go back to prison. And then if you were living with either a friend or you were homeless, you were more than 12 times likely to go back to prison. So, I mean, it really just kind of emphasizes what we already know, is that housing is really essential to people's well-being after prison. And the reasons for that are numerous. People can't, you need a place to kind of work on employment goals. You need a place to, build healthy relationships with the people that you care about. You need housing just to kind of heal. I mean, incarceration is a traumatic experience. And how can you do that when you're sort of stressed about where you're going to sleep from one day to the next? So I really appreciate Earl asking us as academic partners to look at this issue, which is so important for our reentry community and our state to know about, that we really need to do better to provide housing opportunities for people reentering.
So with that being said, some of the things that you guys are looking at, did you notice any difference in mortality and morbidity or lack of continuity of care based on those differentiations of living situations?
We haven't. So mortality and morbidity, we've looked at a number of different housing or health outcomes. And one that stands out is self-rated health. And what we did for that study was look at housing assistance. So people who received housing assistance as compared to those on the wait list were more likely to feel that they rate their own health higher than people who were on the wait list. So, and there's probably a few other findings, but I don't want to speak without reviewing exactly what was found. But we have, I think, we've often looked at it through the lens of housing assistance and that impact that has on people's lives.
Okay, I know you presented in New Haven at the roundtable. You presented in Bridgeport's roundtable with this information, and you've gotten kind of sparked with some ideas to kind of peel back some more layers on the information. Probably, I think one of them is looking at the impact on those folks that have been incarcerated coming out, and the housing instability and the impact of those with children. So that'll be something we'll be taking a look at. I know we talked with Dr. Cooper over at UNH and the Tao Foundation, so I'm interested in seeing about following up with that. I'm definitely interested to see some note comparisons between this state of reentry point in time count that's just been released. Make sure to get that over to you if you haven't gotten it yet, so you can take a look as it delves into these specific geographical areas of Bridgeport, New Haven, Hartford, just basically all the 10 geographical locations in Connecticut that a Reentry Roundtable Council resides. So I think there will be more information that could be partnered to get a better picture and a better sense of what's going on with these folks, what helps contributes to success, and a lot of the things that we already know that helps contribute to an increase in recidivism and definitely a less reduction in public safety. And how all this stuff all intersects, because like you said, we're hard pressed to expect somebody to come out after being away for however much time and come back into just reinsert themselves into regular community life without dealing with the trauma. A lot of the times these folks had trauma before they went into the system. They got additional trauma while in the system, and then whatever health impacts that may have been can be exacerbated while they're in and then coming out. Lack of continuity of care, lack of housing, but we expect them to walk a straight line while also dealing with many of the collateral consequences that both Rob and Dwight and Gus talked about. Just carrying a heavier load, but expected to be successful like everyone else while having this heavy albatross around you.
Yeah. I think, one thing to tie, that ties it in for me is sort of I'm interested in that point in time report because I think one of the huge legislative successes in last year was clean slate, right?
Mm-hmm.
So people now, after 7 years for low-level felonies and for 3 years for misdemeanors, will be able to have their record expunged automatically. So
Mhm.
really tracking like who's eligible for that, who's taking advantage of it, who knows about it, I think is going to be one area where data can really show us the impact of such a law and also push us to kind of tweak our legislation to be even more effective and helpful by looking at the data. So, and
No.
I'll just, yeah.
I definitely agree with that. As Gus alluded to, and I said as well, we were very happy to get that milestone because we had been brought up in a couple of legislative sessions previously, and people have been, started working on that in 2007. And while it doesn't cover everyone, it does cover some folks. And we look to, like you said, looking at that data, expand it to cover more people because that also impacts people's social economic mobility. I can't tell you, and I'm sure I'm not unique in this experience with sharing stories that, you help somebody get employed, they've been working there 2-3 weeks, and then all of a sudden they get a tap on the shoulder saying, well, your background check came back and we can no longer employ you. So, how are we expecting people to contribute to society, be taxpayers, and again, a focus on public safety when they can't get stable employment or livable wage or not have to work under the table to receive, funding to take care of themselves and or their families. They're hard pressed to do it. And so along with that, one of the things here in Bridgeport that we're starting up to is a free pardons program, pardons and expungement program, where we'll be doing workshops once a month and connecting folks with folks through Connecticut Legal Services and in a partnership with Quinnipiac law students to help kind of navigate the online process that is the Board of Pardons and Paroles pardon and expungement process. So more to come on that. That should help in conjunction with those folks that may not be covered under the Clean Slate Act, which will, I believe, go into full effect in 2023. It hasn't started yet. They're still kind of working out the details. So, and there are a lot of people that need that. They need to get that scarlet, for lack of a better term, they need to get that scarlet letter removed so they can move on with their lives. We're talking about people that have been, 20 plus years from any criminal activity, but then they still can't get gainful employment because of being impacted by something they may have done when they were a teenager. So all great, all important work that you guys are doing. I can't stop gushing enough over the partnership and collaboration that's taking place in the state of Connecticut, whether it's via, something in the academic circles, via financial literacy, via policy work and grassroots awareness. There are a lot of good things, a lot of great people doing a lot of good work, some that have been named here and many that have not been named. And hopefully, I get another opportunity and we can highlight and spotlight some more that's going on in the state of reentry.
Thank you, Earl.
Yeah, maybe I can just give a shout out to Connect. So I'm part of Congregations Organized for New Connecticut, which is an organization that helped Clean Slate pass. And the beauty of that organization, yeah, and it's a huge organization with so many faith-based groups. So if your faith community cares about criminal justice or criminal legal reform, that's a great way to get involved and to learn about the legislative process as well. That's how it taught me so much too.
It's funny that you say that because I had 2 interns in 2020 into 2021 working with me. Actually, these were 2 interns that sought out the Mayor's Initiative for Reentry Affairs program in Bridgeport because one of the students lived in Bridgeport, was from Bridgeport, but these 2 students were intern and they were students at Penn State. So they were students at Penn State and they were my interns here working with me to get some stuff going. And then they also helped out Connect with their social media strategy.
I never met them, but heard about them. That's great.
Yes. So it's all interconnected. A lot of great work is being done and a lot, I'm hesitant to say it, but a lot of great work still needs to be done. So guys, take whatever break you need or breather, and come back re-energized because we have a lot of great work yet to be done. And I hope we're also building up a very strong bench behind us because, time waits for nobody. We're not going to be able to do this forever. So I know, speaking of that, because Barbara Fair has been working forever in these endeavors around solitary confinement, along with some other folks like Brother Fred Hodges, Daim McKnight, Kenny Jackson. There are a lot of folks that have been working tirelessly. Scott Wilderman, a whole bunch of folks that have been working tirelessly. Bill Dyson, have been doing great work around this, and we've been building on it. And so I'm looking forward to seeing a lot more successes as we go along. I want to thank you guys for your time. You've been amazing guests and provided amazing information. And it's been a pleasure and an honor to work with you guys in this format right here and in other things that we'll be working on going forward.
Thanks for having us, Earl.
Yes. Thank you, Earl, for this great forum, for hosting this great forum.
No problem.
Okay.
As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. I'm never gonna give up. Fall down, I just gotta get up, yeah. Cause this is my road, lights, camera, action, I'm ready to go. I'm never gonna give up. Fall down, I just gotta get up, yeah.